Hello all, and welcome to the Caregiver Support Series.
Hey everyone! Wasn't it so great to have our first guest host last week, Maren Simon? This week I will be reviewing some of the medications commonly used by hospice and palliative care programs across the country for patients who are terminal. Please sit back and relax with a cup of your favorite hot beverage, and as always, feel free to reach out to me with questions, comments, or topic suggestions. Today I will be using words to describe to explain symptom management, which is what I consider the gold standard for hospice and palliative care. It is brought to you by one of my personal idols, Dame Cicely Saunders. The Education Corner will go over 4 common symptoms and a few common medications to treat those symptoms. As usual, there will be additional related content for you at the end of the episode, and my sources are cited in red. Next week's topic is Busting the Myths of Hospice, Part 1. Dame Cicely Saunders is considered the founder of the hospice movement. She was an amazing woman who advocated for one of the most vulnerable and underserved populations of her and maybe our time, the terminally ill. Over the course of her career, she became an interdisciplinary team in her own right, a trained nurse, then social worker, and eventually physician, who is credited with the concept of total pain that is utilized in hospice and palliative care programs all around the world. Total pain is a unique kind of pain that one only experiences when they are facing the end of their life. Most people think about physical symptoms like pain, shortness of breath, and anxiety, but symptoms can be psychological, spiritual, social, or practical. And sometimes one symptom could manifest itself in different categories. For instance, someone with a tremendous amount of guilt or who is in need of forgiveness or closure may have physical pains and aches related to those emotions. It was during her time as a social worker that Dr. Saunders noticed that hospitals were not well equipped and hospital staff were not very well trained to handle the unique issues that come up when someone is given a terminal diagnosis. So she came up with the notion that not one specific specialty or discipline could effectively assess and treat each of the different aspects of total pain. It had to be a team of people within a few disciplines: a doctor, a nurse, a social worker, a hospice aide, a spiritual caregiver, and a volunteer. This is the hospice interdisciplinary team. So when we speak of symptom management, we could be speaking of physical pain. We could also be speaking of the need for forgiveness, the loss of independence, shortness of breath or anxiety or both, maybe depression or thoughts of why me, anger with God, maybe insomnia or restlessness, confusion, nausea, family or caregiving issues. The list of symptoms could seriously continue. The point is, the philosophy of hospice and palliative care is understanding that these are sensitive issues. Time is built into the visits for these specialties to do their best work. And when they're working together as a well-oiled machine, this interdisciplinary team can make a huge impact on the way people in their community face death and dying. For the Education Corner today, I'm going to lump a few symptoms together to talk about 3 different types of medications that can help a patient in their home instead of having to go to a hospital. At Hospice of Northwest Ohio, we typically give patients what we call a stat pack once they are admitted to the program or when we deem it appropriate. This emergency pack of a very small amount of medication is intended for just that, emergencies. We want the patient or caregiver to call us if the patient is having acute symptoms so we can advise them on what to try and send a nurse out to assess. The first medication I'm going to touch on is an opioid, which is included in our stat pack to treat short-term or sudden pain or shortness of breath. Opioids work to treat both symptoms. If you haven't checked it out yet, one of my previous episodes explained how opioids help in treating shortness of breath. Common opioids used in this situation would be morphine and Dilaudid. Another common and potentially traumatic set of symptoms includes anxiety and restlessness. The medication put in the emergency pack is dependent on a few factors. The doctor will base their order on the patient's terminal diagnosis, past medical history, current medication list, and current assessment. The doctor may prescribe a benzodiazepine such as Ativan or Xanax, or an antipsychotic such as Thorazine or Haldol. All of these medications potentially treat anxiety and/or restlessness, but it depends on the patient's age, past medical history, etc. And finally, a medication to treat what we call terminal secretions is included on the prescription for the stat pack. When a patient is reaching the very end stages of life, they lose the ability to swallow or cough up any oral secretions, but their body doesn't necessarily stop making them, so they tend to pool in the back of the throat. While this is a totally normal bodily process for this stage of life, it can be terribly upsetting to family members because of the rattling noise those secretions make. The medications used to treat those types of secretions are used with caution because they have some serious side effects. And frankly, they don't take the secretions away, they just stop them from increasing further. I usually have patients' family members cover their ears and look at their loved one. If what's happening is truly terminal secretions, the patient is going to be in a coma-like state. So with their ears covered, I have them look at their loved one's face. If it's relaxed, if their breathing is even and not labored, and they have no furrowed brow, then the secretions are not bothering them. So it kind of turns into a risk versus benefit situation. If the patient appeared in distress because of the secretions, the benefit of the medication may outweigh the risk. But if they're relaxed otherwise, they probably don't need that medication. Again, terminal secretions are normal, and they can be treated without medication by practicing good oral care and gently turning the patient from side to side. As a hospice nurse case manager, I had my fair share of what we call opioid naive patients. This means they've never been on an opioid before. So explaining to them how they work, what's expected, what's not normal, and answering many questions is ingrained in the role. My first tip is, accept the stool softener when we give it to you. Just keep it in the house. You don't have to take it until you feel like you would need it, but it should still be there. We take bowels seriously because after so long, constipation can become an emergency. Does anyone remember my mailbox reference? Second, always feel free to ask questions and advocate for yourself or your loved one until you're comfortable with the medication. Ask your nurse to stay with you for a little bit after you've taken your first dose. I usually did that with my patients who were particularly nervous. You should have a part in deciding your pain medication regime. Thanks for watching. This has been an episode of the Caregiver Support Series brought to you by Hospice of Northwest Ohio. Next week's topic is Busting the Myths of Hospice and Palliative Care, Part 1.